Rahim. This video is about acid-base disorders, and I'm going to explain how to interpret the ABGs in this video. And I'm going to do it in a simple way, and to ensure that it's simple, I have with me my sister Maryam, who is not a medical student. So let's begin. So Maryam, do you know what are ABGs?
Nope, I have no idea.
ABGs mean arterial blood gases. Normally when we take sample, we take it from venous blood. But in ABGs, we take arterial blood and we put the sample into a machine and it gives us a report. And from that report, we have to interpret whether the patient's blood has normal pH or the patient is in acidosis or alkalosis. So we can interpret it by the help of three things which are in the ABGs report, which are first thing pH, second thing is partial pressure of carbon dioxide, and third is bicarbonates. So these three things are very important, and from only these three things we can interpret whether the patient is in acidosis and in alkalosis. And basically there are 8 to 9 categories into which we can categorize the patient. So you know what's alkalosis or acidosis?
No.
Okay. Basically our human blood, the pH of human blood is in a very narrow range. It is from 7 point, not this marker, use the other one. The normal value of pH is 7.35 to 7.45. We should know the value. If the pH is deranged, then the patient, it's basically lethal. The person can die if the pH is deranged. So if the pH becomes less than normal, then what does it? Is it acidic environment or it's basic environment?
Well, as far as I know, low pH means basic. No, acidic. No. Sorry.
Low pH means acidic, okay?
Okay, low
and
pH
high
means
pH
acidic.
means basic. Basic means alkaline, okay?
Okay.
So if the pH is, okay, let's say write acidic here. Acidosis, okay? Acidosis occurs when the pH is low, and alkalosis, alkaline environment, occurs when the pH is high. Okay.
Okay.
So the first category is I'm going to tell you the normal values of these two, because the first thing to know are the normal values. Okay, I'm going to tell you right now. The normal value of partial pressure of carbon dioxide is 35 to 40. 35 to 45, I think. Wait. Yep, 35 to 45. And bicarbs are 22 to 28. I remember it Urdu 22 से 28, 22 to 28. Okay, so first thing you see is the pH. Okay, from the pH you can tell whether the patient is in acidosis or alkalosis. Okay.
Okay.
Then it's not just about acidosis and alkalosis. You have to see what is the reason behind acidosis and alkalosis, whether it's respiratory acidosis or metabolic acidosis, or respiratory alkalosis or metabolic. So respiratory and metabolic, you further categorize in respiratory or metabolic.
I have a question.
Yes.
Didn't you just say that having a pH slightly above or slightly below is lethal? So wouldn't a person be dead while you're testing them?
Not dead, but about to die if you don't intervene. And if his body is not compensating, trying to bring the pH back to normal, like slightly, like this is the normal value, normal blood pH. If it is deranged, then the patient is going into like a bad situation, right. And he can die if his pH becomes even more higher.
If you don't.
Yeah, this is basically normal value.
Okay, got it.
Okay, so then we have to see whether it's respiratory or metabolic. Now these are important because Increase in carbon dioxide leads to a low pH, because carbon dioxide is an acidic gas and carbon dioxide is exhaled while respiration.
Right.
So if the pH is deranged due to carbon dioxide, then we call it respiratory, whatever, acidosis or alkalosis. Okay.
Alright.
So carbon dioxide shows respiratory problem. Okay. And if bicarbs are excreted by kidneys. If the pH is deranged due to bicarbs, then we call it metabolic. So by the help of the values which we have to categorize it into either normal or respiratory acidosis or metabolic acidosis or respiratory alkalosis or metabolic alkalosis.
Is there no other way that the pH can be affected?
Yeah, just these two things.
Okay.
And then there's an additional thing, that whether the body is compensating or not. And only these, because there are only these two methods. If the pH is deranged due to this, then the compensation would be taking place due to this. Okay, due to the other thing.
Right, yes.
Okay.
Yes, because it is complementary of the other.
Yeah, it's like a seesaw. Okay.
Yes, got it.
So the next thing we have to see is whether there is some compensation or not. Body is compensating or not.
So in the normal,
and trying to bring the pH back to normal via alkalinity, or like trying to increase the pH. Okay.
wait, when you manually, like when a doctor manually intervenes and he tries to increase or decrease the pH, you do it by either bicarbonates, that's called bicarbonates,
yes,
or carbon dioxide, right?
Yeah, but right now I'm not talking about manually interpreting it. I'm talking about what the body is already doing, natural thing. We are just interpreting it. Okay.
Yes, all right.
So this is like I'm going to raise it now, but this was just, I was explaining that what we have to categorize it into. Now, like you just tell me, if what should I write? Arrow should be acidosis occurs when pH is carbon dioxide, basically acidic gas.
Yes.
So carbon dioxide should increase or decrease for acidosis, or what? It's an acidic gas.
Should decrease.
It should increase. Carbon dioxide is an acidic gas. If it is more in the body, it will lead to acidosis.
Didn't you ask? Wait, I don't get the question.
Basically, I'm just like I wrote it here. If pH is less, it shows acidosis.
Yes.
In acidosis, pH should be less. In alkalosis, pH should be high.
So you're asking me
So in if we should know, I'm just like trying to what does low carbon dioxide mean?
What does low carbon dioxide
And
mean?
what does high carbon dioxide
then yes, if it is an acidic gas, then low carbon dioxide mean less acidic, so
Yeah.
it would be alkalosis.
Yeah, so in alkalosis, carbon dioxide will be less, and because it's acidic gas, so high carbs mean acidosis.
Okay.
Bicarbonates, like you have read, sodium bicarbonates, potassium bicarbonates, these are bases.
Right.
So high bicarbs means alkalosis. Okay,
Okay.
and low bicarbs means acidosis. So these are the basic things, basic concepts we should know in order to interpret it. Okay, you get it?
Yes, I get it.
Now I'm going to tell you how we can interpret it by just these three things. So first thing you see is the pH, because it tells you that whether the patient's pH is normal or the patient is in acidosis or in alkalosis. So let's say if the pH is less, what does it mean, Maryam?
It means if it's less, so it will be acidic. So yes, acidosis.
So it means that the pH is the patient is in acidosis. So you write acidosis. Patient is in acidosis. Now we have to see whether it's respiratory or metabolic. So then you see carbon dioxide. Suppose the carbon dioxide is less. What does it mean?
Carbon dioxide is less. It means since carbon dioxide is acidic, so it will be alkalosis.
Yeah. So it means alkalosis. Then you write the next. If suppose bicarbs are less, what does it mean?
Acidosis.
acidosis. Good. So then you see what is the cause of acidosis. Which of these match with pH? Carbon dioxide, right?
Bicarbonates
Yeah.
too.
Acidosis and acidosis. So the cause of acidosis is,
Metabolic.
yeah. So you write metabolic acidosis. Then you see whether the other thing, the counterpart, is compensating, trying to bring the pH back to normal by alkalinity, by the other thing, by the opposite thing, or not. Is it?
It is.
Yeah. So we write metabolic acidosis with respiratory
Compensation.
or we can write partially compensated metabolic acidosis. It's partially because if it's completely compensated, then the pH will become normal, and carbon dioxide and bicarbs will be deranged. Both of them will be deranged because one thing changed the pH and the other thing brought it back to normal. But these scenarios not given in exams, but these can happen, especially after the treatment, or especially after the patient is better. One more thing.
Yes.
If they like in the same scenario, for example, if instead of alkalosis it is normal value, then we have acidosis, which is metabolic acidosis without any compensation. So it's just metabolic acidosis. Now this scenario is just metabolic acidosis. Okay. So do you get it?
Yeah.
Is it easy?
Yeah, it seems okay.
So can you do some examples now?
Yep.
Okay, so now I'm going to erase it. And I'm going to write the normal values here for you. So pH normal value is 7.35 to 7.45. Okay. Carbon dioxide, partial pressure carbon dioxide normal value is 35 to 45 millimeter of mercury, and bicarbs normal value is 22 to 28 milliequivalent per liter. Okay, so let's do some examples. Select an example from 1 to 13. Which one do you want to do?
8.
Okay, number 8. So I'm going to tell you the I'm going to tell you
Alright.
pH is 7.33. Partial pressure of carbon dioxide is 29.
29.
And bicarbs 16.
16.
So right below each.
Alright, this is in the normal range.
So see again. 7.
Oh, sorry, I'm sorry. This is below the normal range, so low pH means acidic, so this will be acidosis.
Yeah.
And then we have CO2 again below the normal range, so this will also be, no, wait, CO2 is acidic, right? So it's less, so it'll be alkalosis.
Yeah.
And this thing is below the normal range, it is basic, so it will be acidosis.
Yeah.
So here we have acidosis because pH, and it's because of this, so it will be metabolic acidosis.
Yeah.
And compensation is happening, so it will be metabolic acidosis with respiratory partial compensation.
It's respiratory compensation is good enough.
With
Or you can
respiratory
write partially compensated metabolic acidosis.
Okay.
You read well, good.
I'll just write partially compensated.
It's okay. You can.
Alright.
We are going to do another example also.
Okay.
So now we have to choose again. Let's erase it.
You had it. Okay.
So which example?
7.
Okay. So the correct interpretation for the given ABG set, pH is equal to 7.51.
7.5.
Oh, we didn't check the answer. What was your answer?
It was metabolic alkalosis.
with
Acidosis, sorry. Metabolic acidosis.
Okay.
With partial compensation.
Uncompensated respiratory alkalosis, uncompensated metabolic acidosis, partially compensated respiratory acidosis, partially compensated metabolic.
Partially compensated metabolic acidosis.
Okay.
Option D.
Okay, question number 8. Answer is D. Good. Okay, now question number 7. pH equal to 7.51.
Yes.
Okay, partial pressure of carbon dioxide is 40.
40.
Bicarbs 31.
31.
Okay, now right.
This is above the normal range, so this will be higher pH is basic alkalosis.
Yeah.
This is in the range, so this will be normal.
Okay,
and
good.
this is above the range, so this will be, since this is basic, so alkalosis. And our diagnosis is alkalosis, metabolic alkalosis with
Without
no compensation.
you just
So
write
we will
metabolic
not
alkalosis.
write anything.
Good.
There is no compensation.
Good. So you got it. So basically you have to see the pH first, and that is, you write alkalosis or acidosis, and then you see whether this matches with this one or this matches with this one, and you write either respiratory or metabolic, and then you see the counterpart and tell whether it's compensated or not. That's it. Thank you. Thank you, Maryam.
No problem.